The sick, the injured, the needy. There's little space left for them in Idlib. Dr. Mahib Kadur treats more than 1,000 patients a day with just a tiny staff.
There is a large number of patients, and if just a few doctors, specialists, we have 3 or 4 just.
The current ceasefire came too late for Amal. Her name means hope, something fast diminishing in Idlib.
She lost her father, her mother, and her brother in 1 year. She just has a sister also injured in the last attack. Unfortunately, she needs many operations and skin grafts. It's a very sad story, I think.
Life is collapsing here. Why is this happening? She whispers. 3.5 million people in the province are wondering the same. The world isn't listening.
Doctor, do you have any doubt that the regime in Russia are targeting specifically hospitals and medical facilities?
Never. I'm sure that Russian Air Force and Assad regime attacked many times all hospitals and health facilities. It's fact, like sun, like moon. It's a fact in Syria, and many hospitals destroyed and still destroyed till now.
Syria's war is reaching new depths in Idlib. This was a hospital until Russia and the regime took it out. One of many we passed that appear to have been specifically targeted. In fields or in hillsides, the onslaught found them. Nearby buildings remained untouched. The United Nations passed on a record of their coordinates to Russia to ensure their protection. Instead, it became a target hit list, as the same places were hit again and again. Russia and the regime's campaign has been horribly effective. It's terrifying. All of these towns and villages that we've gone through have been abandoned because this is a war against what matters to people. Their homes, their schools, and their hospitals. This was a hospital until a few months ago. It's one of 40 that have been attacked since April this year, and it's causing people to flee in their tens of thousands. This is the last refuge of those who oppose a government which has brought their country to ruin.
How can you still, in these dire straits, pass over coordinates to Russia, which are then shared with the regime, which will involve more targeting when this ceasefire ends?
So the coordinates is a preventive mechanism. Many of the facilities...
But it isn't preventing attacks on hospitals.
At the same time, I think we're now upping, further strengthening the mechanism.
40 hospitals have been attacked in the last few months.
And many more schools have been attacked, and many water points have received direct hit.
So the system was broken.
So the system of preventing and protecting the civilians has completely failed. As humanitarian workers, I don't think we can be blamed for that. As I think as humanitarian workers, we provide life-saving assistance, and we really ask everybody with these coordinates to make sure that this is respected. If anything, sharing the coordinates should bring more awareness, more also accountability.
That gives little reassurance on the ground. Life here is filled with peril. Going to work is an act of courage. Medical staff say they have a target on their backs. So head nurse Mir Al-Aswad takes care when he goes to a hospital in a secret location. His hospital is buried deep out of reach of the bombs. We were told to move fast too. Even under this solid rock, they await the next attack. The UN says humanitarian operations are about to reach breaking point. Airstrikes aren't the only worry. If regime ground forces advance a few kilometres, then here will be abandoned too. So So people continue to race to the border. We headed south, deep into Idlib, escorted by the self-styled Salvation Government. The men who rule here are deemed terrorists by the West, but these camps are full of families and innocents. The Assad regime doesn't discriminate.
There's no question that attacking civilians, hospitals, schools is a war crime. Do you think anybody will ever face justice?
I don't think. Nobody care. I hope I can see justice in Syria for every one who injured Syrian people. But I don't think I will see it all my life, at least.
Amal and Tasneem have known only this war. It's far from over, but already the living, the dead, the injured have been forgotten here. Quentin Sommerville, BBC News, Idlib.